Good afternoon, everyone. So today is Wednesday, May the 5th, or May. No, it's not May, it's March, March the 5th. And we are so excited to have Brooklyn with us this afternoon. Brooklyn is a dental hygienist student who has a great connection to Parkinson Association, and I will talk about that. But first of all, for those of you that don't know me, my name is Charlene. I am one of the client services coordinators. I work out of the Edmonton office, and I will be the moderator for our presentation today. A couple things. If you have questions during the presentation, if you could please submit them in the chat. So for some people, the chat function is at the bottom of their screen. For other people, it's at the top of their screen. It kind of looks like a little talking icon. And if you could submit your questions there, maybe what I'll do is I will have Candace start that conversation just so people can see where the chat is, and then any questions that you have, you could submit them there. We will take a kind of a brief break when Brooklyn has time, and if there are questions and people are unable to submit them, then we will open it up to questions at that time. I also just want to remind people that this webinar is being recorded. All the information provided in this video presentation by Parkinson Association and our featured speaker is furnished strictly for educational and entertainment purposes. The service is not intended to be diagnostic, prescriptive, or to replace the relationship and or advice and or care of your physician. General questions about symptoms or treatments and complementary therapies, those sorts of things can be answered during today's presentation. So as I said, Brooklyn has a connection to Parkinson Association. Her grandfather has Parkinson's, and she herself has been very involved with us at a lot of our walks and our information and education sessions, and has been a great supporter of us, and we very much appreciate that. I also wanted to say that we know that her knowledge and her expertise in oral care for people with Parkinson's is something that we are very interested in. And so I just want to say, before we get going, thank you again, Brooklyn, for sharing your time with us. And now I will turn it over to you.
Perfect. Thank you for the introduction. And I appreciate you guys letting me come here and do a presentation and talk about some oral care. So I'm just going to share my screen here. And then if you don't mind, Charlene, just letting me know if you can see my presentation when I pull that up here. I'm going to minimize this. Okay, are we able to see the presentation here?
All looks good. Yes.
Perfect. Okay. So yes, thank you for the introduction again. So my name is Brooklyn Schroeder, and I'm going to be talking today about oral care for Parkinson's disease. And so this is under the SMILE program that we have at the University of Alberta. So I am a dental hygiene student, and I'm in my 4th year of the dental hygiene program at U of A. So the SMILE program is just a way for us to kind of spread awareness about oral health education and just educating people around the world. And we'll go next here. So a little bit about myself. So just some personal background so you guys can get to know me a bit more. I used to be a big hockey player. So in this top left corner here, I have my Team Alberta jersey on. And so I was able to play hockey for quite a few years and win a gold medal at the Canada Winter Games, which was an awesome experience. And then when I shifted over to playing university hockey, I was at MacEwan University. And so I got to play a few years there, and then it kind of brought me to U of A afterwards. And during high school, I played for the St. Albert Slash. And you can see up in the corner here, I have my dog Harley. He is a big Oilers fan. The Oilers, I don't know if we have any Oilers fans in the room, but they haven't been doing so hot lately. So hopefully we can turn that around. But just a personal story, I do really enjoy hockey, and that's something I kind of enjoy doing on the side of being in the dental hygiene program. And so another slide here is you can see a little bit more about myself. So just to give another picture, this is kind of what I would look like in the clinic if you guys ever did come to the University of Alberta to get some oral care. And so these are two of my friends, Vanessa and Meg, and they also help out with the SMILE program and often do presentations for different programs as well. And so sometimes they join me in presentations, but today I'm just going to be here by myself, which is great. And then this is another picture of Meg and I, just a funnier one, but we're at a rotation up in High Prairie, or sorry, High Level. And so that was a really good time. And so now a little bit more personal. So my connection to Parkinson's. So like Charlene had mentioned, I do have a grandpa with Parkinson's. His name is Doug, and he was diagnosed around 63 years old. So I think when I was 3 years old, when I was talking to my mom, he had been diagnosed. And so ever since I've been growing up, he has been battling this. And that's kind of like why I want to present to today. So this is just a little picture of us. We do the step and stride at that the Parkinson's Association puts on, and it's a great activity to do. So if you are able to, or you have family members that want to join, I encourage everyone to take part in this. We've been doing it for many years, and I think the one year we raised enough money to get t-shirts, and so that's why we all have the matching t-shirts that say Victor Team. So you can see my grandpa in the middle there, and then my brother and I on the side. So, and then we got the extended family, and there's many more of us that come to the walk. So that's kind of my personal connection. And then just kind of what we're going to be talking about today. So what I want to touch on is how Parkinson's affects the mouth. So I am going to be giving some general information, but I also want to tailor it a bit more to Parkinson's itself and give everyone some product recommendations that can help with some oral symptoms that you may be experiencing from Parkinson's or just other things in life. Like lots of people experience dry mouth. If they don't have Parkinson's, it's very common. So just trying to give everyone a general idea, as I know it may be some family members listening as well. And then what to expect with a dental hygienist and a dentist. So when you are going to an appointment, you kind of have an idea of what you can expect or what to look for and things to kind of look at overall. And then in the end, we're going to do some time for questions, as well as if you have any during the presentation, like Charlene mentioned, you can put it in the chat, or I can take a break and we can kind of go from there. And so I just encourage you, if you have them, just write them down and we can touch on those after. And so my next thing here is individuals with Parkinson's and what are they more likely to experience in the mouth. And so some of the things you can look for is periodontal involvement. And so I tried to include some pictures just to help give a bit of a visual. So you can see in this top left image here that there is some bone, and it says healthy bone and bone loss. So these roots of the teeth, we have the crown of the tooth and the roots. And so when there's less bone, that root of the tooth is a bit more exposed. And so you can see in that image on the left, there's a little bit more black in the background. And so that's telling us that there's been some bone loss on this patient. And then what can happen over time is that that tooth can actually become mobile and they can eventually lose that tooth. And so we want to take a bit more of a preventative approach and try and reduce that bone loss as much as we can. And so ways we do that is by going to our dentist and our dental hygienist and making sure that we kind of stay on top of that before it gets severe where you do lose that tooth. We also have a higher chance of having gingival recession. And so that's when our root of our tooth is showing outside of our gums. And so we want to make sure that we try, and when we're brushing, we're using a soft toothbrush, which I'm going to talk about later, and that we're actually not brushing super hard. It's more about the technique of the brushing. And I know that can be a bit more challenging if you do have Parkinson's. And so there is some recommendations or different toothbrushes that I will be touching on that can kind of help with that. And so if you do have recession, it can often lead to a bit more sensitivity in the mouth. And so it's just really important to try and use a sensitive toothpaste and those kind of things to prevent that from getting worse. as well as if you do have recession, so that means more of your root is showing, you have a higher chance of getting cavities. And so when I say here untreated dental caries, that's another word for a cavity. That's like the dental term we use. And so that's like a little pit and there's bacteria in your tooth. And we want to stop that as fast as we can so that it doesn't cause us to lose that tooth or we need a really big filling. And if the cavity is small and we detect it right away, then we can actually stop that cavity from getting bigger and maybe not to need to do something very invasive, if that makes sense. We'll go to the next slide here. Okay, and then our next one is caries risk, so another word for cavity. And so if you feel like you have a cavity, some of the things that you may experience are sensitivity to hot and cold temperatures. So if you're drinking a coffee or really cold water and you notice one tooth is really bugging you, that could be a sign of a cavity. Or if you eat lots of sweets, I remember one time I was eating a chocolate bar and I could feel it on one of my teeth, and I ended up going to the dentist a week later and I did have a cavity there. And so it was really small. They were able to not have to do any fillings, but it's just things to be mindful in your mouth. And so you can try and prevent that from progressing, and it would be more expensive in the long run too. So ways we can stop a cavity, like I had mentioned, is using fluoride. And so we get fluoride in our toothpaste, it's in our water, and lots of other things like different foods like fish. And so just trying to really have a fluoridated toothpaste is something that I would really recommend for everybody. And oftentimes patients with Parkinson's, like I had mentioned, they do have a higher chance of getting cavities. And so it would be beneficial to get a higher fluoridated toothpaste. And I recommend this to all of my patients who have a high cavity risk. It doesn't have to just be people with Parkinson's. So if you know a family member who is always getting cavities or yourself having that same issue, then a higher fluoridated toothpaste is a great way to prevent this. And so I have a little picture here on the bottom screen. If you want, you can take a picture on your phone or you can ask me after and I can give you the name, but it's ClinPro 5000, and you can get that at Walmart. I believe you can even get it on Amazon, or you can just ask a family member and they may be able to help you out with this. Also getting a fluoride varnish. So I don't know if anyone has went to the dental clinic before and they've had those trays of foam. And so those I found for myself, they're very full in your mouth, and it's hard to kind of like breathe and all that stuff. So I can imagine how it's not always the most comfortable thing to have done at the dental clinic. And so we actually have what's called a varnish, and a lot of clinics do have these now, and it's where we paint it on the teeth. And so you don't have that big foam tray in your mouth, and you can spit with the varnish at any time. So it's a lot more comfortable for people and you don't feel kind of that suffocating feeling in your mouth. And so I would recommend for anyone who has a high cavity risk, which is often most people with Parkinson's, we're doing it every 3 months, getting that fluoride varnish done. And you have to get this done at a dental clinic because you can't buy this off the counter since it's such a high percentage of fluoride. And so when you go to the dental hygienist and you get your cleaning done, they usually will offer a fluoride varnish, but if they don't, then that's your job to kind of ask for that and say, can I get a varnish? And they'll be able to give that to you. I think they cost around $30 now in private practice, and they aren't always covered by insurance, but this is a great way to kind of stop cavities from happening. Okay, so why is this important? So what we want to do, why I'm telling everyone about kind of things you can look for in your mouth is because we want you to book an appointment with your dentist if you feel like this is happening to you. And we want you to book an appointment with your dental hygienist and stay on top of your oral care. And so I recommend seeing a dentist or a dental hygienist at least every 6 months. And then if you find you're just not able to brush as well, or your mouth is causing you more problems and you have lots of plaque, then every 3 months might be really beneficial. And that's just because if you have deep pockets, the dental hygienist can kind of get in there and get that soft plaque out. And then you don't feel like it's going to be a progression of disease yourself. It's your way of getting your teeth professionally cleaned if you can't do it as well at home. And so we want to create the best possible environment for prevention and maintaining that oral health in your health, okay? And then the best way to prevent possible systemic complications is early treatment. So we often say that your mouth is tied to the rest of your body. And so if we try and keep your mouth clean, that's a less bacteria in your mouth and that's going into your body. And so that does connect all around. Now, bringing all health professionals together. So we all want to work as a team. So the dental hygienists work with the dentist, they work with dental assistants, they work with your physicians, and they also work with things like physiotherapists. And so it's really important that you kind of to keep all of those healthcare providers involved about your entire circle, because we want to make sure that they know that you are getting dental care. As often if you need a treatment done, I know I had a patient who had to get a heart valve replacement and they needed to get their teeth cleaned before they could get this done. So just trying to keep all your healthcare providers involved so that they understand. So oftentimes, for just an example, when I have patients and they maybe have jaw problems with opening and closing their mouth, we'll recommend that they go to a physiotherapist. And so when you go to your dental hygienist and you maybe are seeing a physiotherapist for your jaw, you can just let them know. And so that kind of they can make a note in their chart and they can kind of check that off as that's being taken care of, and they can kind of move on to the next part of your mouth, because we don't just look at your mouth, right? We look at your overall health. We should, whenever you go to the dental clinic, they should be doing like an extra oral and an intraoral screening for cancer. So oftentimes when I see my patients, I'm feeling, I don't know if you guys can see me, but you want to feel around your head and neck and kind of just make sure that you don't feel any lumps and bumps. You can do it on the side of your neck here and just these kind of things, because we want to make sure that we're making sure we do a preventative approach and we're trying to kind of stop anything from progressing. And so the coordination of care is really important to make sure you're getting effective treatment. And often, like I had mentioned, certain procedures will require good oral care before proceeding. So make sure you just kind of let everyone in your circle know what's going on with you. Okay, and then factors that increase the likelihood of oral disease. So dysphagia is one of the ones, and that's just trouble swallowing. So if you have trouble swallowing yourself, I'm going to give you some recommendations on what can kind of help protect your oral cavity so that if this happens to you, it's not going to affect your teeth, okay? And so oftentimes, when you have dysphagia, it can lead to acid reflux, which causes tooth erosion. And when you have erosion in your teeth, it allows you to be a bit more sensitive to certain things. So we want to try and prevent that from happening. And so I'll talk about that in the next slide on how we can do so. Another thing is xerostomia. And so this is another fancy word, but all it means is dry mouth. And so lots of the medications that you may be on, Parkinson's are not related, they have that side effect of dry mouth. And so what the problem with that is, sorry, is that it increases acidity and it gets rid of the minerals on your teeth. And so they're more prone to getting cavities, as well as if your mouth is really dry, you may even see ulcerations, which can be very painful. And this can also lead to burning mouth syndrome. So I have that in the top right here. And so periodontal disease, which is what I had kind of talked about before with the bone loss. So if you have bone loss in your mouth, that means you have periodontal disease. If you have this, then you're 5 times more likely to have this burning mouth syndrome. And so areas that this can happen is on your tongue, on the top of your mouth, or your lips. And what it feels like is a very painful burning sensation. So if you're eating spicy foods, it may hurt a lot more. And so I'm going to talk about that as well. And lastly is attrition. And so what this is it's wearing away of your teeth. So oftentimes you might wake up or you just feel like you're constantly clenching your teeth. And so we want to try and prevent this by potentially wearing a night guard, or just if you feel like you are clenching your teeth, trying to relax your muscles and be mindful of that so you aren't doing it as often. I know I wake up sometimes and I'm like, oh, I've been clenching. And so I try and tell myself to not do that. I know it's easier said than done, though. Okay, so burning mouth syndrome, like I had mentioned before. So in this picture here, this is kind of what it can look like, okay? A little bit of a red border and kind of your tongue in one spot may look a little bit different than the other. But that main symptom is going to be that burning feeling. And so, ways that we can try and reduce this if you do find you have burning mouth syndrome is taking some iron supplements. Another one is vitamin B supplements, or you may be able to get an antifungal therapy from your pharmacist, your dentist, or your dental hygienist. Some dental hygienists can prescribe, and they'll give you something called clonazepam. And that one will kind of help with that burning mouth syndrome. So, if you ever feel like you might have something going on, it's important to go to your dentist and just ask them, and they'll be able to give you a prescription. They also, another one is this alpha lipoic acid. And so this is something that you can get a supplement if you do struggle with this. And then another one is just prevention. So brushing your tongue, that one's really going to help. You can just use your toothbrush and stick your tongue out and brush down. A lot of people do forget to brush their tongue. So that's really important to start doing if you are one of those individuals. Okay, and then another thing is these products for dry mouth, like I had mentioned before. So I have in the top left here, sipping water frequently and then sucking on ice with a question mark. And so the reason I put these here is because my grandpa, who I had mentioned at the start of this presentation, who has Parkinson's, he often is sucking on ice. And so that has been helpful for him. So if it's something you want to do, he does find it beneficial. The only thing is, if you do find that your jaw gets tired and you're chewing the ice, you may want to use a different product that I'm going to recommend here, as well as constantly sipping water is a great way to make your mouth feel less dry. But I know that does cause a problem because you're always going to have to go to the bathroom. So these are some ways to avoid doing both of those things. So the first one is xylomelts. So again, if you have your phone or you want to take a picture, go right ahead. But the xylomelts here, these are like little tablets, and you can get all of these products that I'm going to mention at Walmart or any kind of grocery store, and even on Amazon if you have a family member that you want to order them for you. And what this is the little tablet, and you kind of put it on the side of your mouth, and they're supposed to last around 6 to 8 hours. So some patients only use these once a day. I always recommend them to my patients. And what it does is it stimulates that saliva. And so instead of having like a sugary hard candy, this replaces that. And it's purposely supposed to stimulate that saliva flow and get rid of that dry mouth. And so a lot of people do really like this one. And I'd say this is my number one recommendation for patients who have that dry mouth is these xylomelts. And so the xylitol in the xylomelts is what helps with that. And so if you're someone who likes to chew gum, another one is xylitol containing gum. So this Pure Gum brand, I'm sure a lot of people have seen this at the grocery store. And so that has that same xylitol, which stimulates the saliva flow. However, I do know that chewing things can be really hard on the jaw. So the Xylomelts is a great option if that's a problem for you. And then the last one is getting some sort of saliva substitute. And so you can actually get, it's kind of like a mouth rinse and it's called biotin. And this one also contains fluoride. And so, like I had mentioned before, that fluoride's really good for preventing cavities in our mouth because it remineralizes the tooth and it kind of acts as a shield to protect it from bacteria. So it can't get broken down and turn into a cavity. And so when we have this biotin, we use it like a mouth rinse, rinsing for around 30 seconds, and then we spit it out and we do it 2 to 3 times per day. And that just helps with that dry mouth. So feel free to try any of these products and then maybe if I can get some feedback too. But the Xylomelt is great. I always recommend the biotin, and the gum is a great one as well. Okay, and then this one here, I just want to caution that we don't prescribe this pilocarpine hydrochloride tablets just for the symptom of dry mouth, okay? So if you are someone that has Sjogren's syndrome or you have had radiation therapy, then this one is something that your dentist or a physician can prescribe, and it's not directly supposed to help with dry mouth. That's not its direct purpose. However, it does help with dry mouth, and there is studies to show that. but you have to have Sjogren's syndrome or have had radiation therapy. We can't just prescribe this for the main reason of dry mouth. So that's why those other ones that I suggested, like the Xylamelts and the Biotine rinse, those ones are all going to be your number one recommendation. Okay, and then treating dysphagia. So that's that trouble swallowing. So like I had mentioned, I wanted to give you a bit of tips and tricks if you do struggle with this. So after you feel like you have had maybe some acid reflux, you want to rinse immediately with water. And the reason we do this is because we don't want our mouth to be in an acidic state. So even if you've thrown up or anything like that, immediately rinse with water. I know what people want to do is they want to go and brush their teeth, but we don't want to do that. We want to wait at least 30 minutes before we brush our teeth. And the reason is because if we have that acidic environment in our mouth and we go to brush our teeth right away, we're actually going to be, our teeth are more sensitive and they're, I guess, more fragile. So when we're brushing, we're actually going to be just brushing away the protective layer of our teeth, making it easier for our teeth to be broken down. So that 30 minutes allows the acidic environment to kind of neutralize, which is why we recommend rinsing with water, because that's something that's neutral. If you want to do something that's a bit more basic, I'm sounding like a chem student right now, but if you want to do something more basic, then you can actually rinse with baking soda and water. So just putting a little bit of baking soda and water and swishing that around in your mouth, and that can help kill that acidity in your mouth, as well as maybe get rid of some of that taste, because I know that's a big problem. We don't want to do mouth rinse, so just water, a baking soda rinse, and these type of things, okay? So why I said, what about mouth rinse? And so the reason why is because some patients may face problems with aspirating. So if you have been told that you have a problem with that, or you know yourself that aspirating is something that may happen to you, then I don't want to recommend mouth rinse, okay? And so this is just patient preference, but there's other ways that you can get that fluoride in your mouth. And so by using that high fluoridated toothpaste and other like the fluoride varnish, those type of things. So if you have that problem, don't use mouth rinse, but if you don't, then use mouth rinse. It's great. The only thing is that lots of times people want to brush their teeth and then a minute later use mouth rinse. We actually want to wait around 30 minutes. And the reason for that is because when we brush our teeth, we often have a lot of fluoride after on our teeth from the toothpaste. And so if you go and rinse it with mouth rinse, you get all of that fluoride off that you just put on with that toothpaste. And so we want to give it time to strengthen those teeth before you put something else on them. And I know it's hard if you have something where you want to brush your teeth and you need to get out of the house. You don't have those 30 minutes, but if it is something that you can do, then I highly recommend it. Okay, and then I think this is going to be everyone's most interested slide. So products that can really help you if you do have Parkinson's. And so I had an instructor whose dad was recently diagnosed with Parkinson's, and I was kind of talking to her about some of her recommendations. And one that she really recommends if you don't like using an electric toothbrush. And so an electric toothbrush is the ones where it does the vibrating for you. If you like using a manual one that doesn't vibrate, then this Collis Curve toothbrush is really good. Can you guys see my mouse as well?
Mhm. Sorry, yes, we can.
Okay, perfect. So this Collis Curve toothbrush, the one that my mouse is circling, this one is really good for getting back there. It has a little bit a different shape than a regular manual toothbrush. So this is one that you can try, and you don't have to get all of these products. I just recommend trying one. And if you don't like it, you can always use a different one. But if you have your phone or anything, feel free to take a picture. And then the next one here is this Curaprox toothbrush. And so this one is really great because the bristles are really soft. And so we always want to be using a soft brush head on our toothbrush, but the Curaprox are like especially soft. So if you ever have a tooth removed or a tooth pulled, using this in that area that may be a bit more sensitive is really good, because you still want to make sure you're brushing in that area, but you don't want to be brushing too hard. And so this Curaprox toothbrush is really good. Another one is the Philips electric toothbrush. So I use this one myself and I have recommended this to other patients. And so the nice thing about an electric toothbrush is you don't have to do that brushing motion. You have to just kind of hold it and guide it around your teeth. But if you find that you're really shaky and you don't have control, then it might almost be better to use a manual toothbrush because sometimes you can damage other structures in your mouth if you don't have that same control. And so another option is getting a toothbrush holder. You can get these on Amazon. And this just allows you to not have to hold on to that tiny brush handle because I know they are really small, and that makes it a little bit easier for dexterity. Another one is a surrounding toothbrush. So I know it's hard to tell in this picture, but basically what it is it's like three toothbrush heads all combined in one. And so it just allows you to get more of the tooth in one brush. It's a little bit easier. This one you can get on Amazon for sure. It may be a bit harder to find at a grocery store. And then another one is a floss holder. So I know flossing can be really difficult. It's even hard for myself. So if you have even someone that does your flossing for you, this floss holder may be easier for them to use. It's basically like a really big floss pick. And so you just put the floss in and then it's a little bit easier to get back there for your mouth. Okay. And then recommendations. So just basic oral health techniques that I would recommend everyone doing is brushing twice a day. So we want to brush once in the morning. I usually brush right when I wake up just because of my morning breath. And also you want to get rid of all of that bacteria that kind of has got in your mouth when you're sleeping. Oftentimes we sleep with our mouth open. And so just brushing right in the morning. Sometimes people will wait till after they eat, but then that's a bit tricky because, like I had mentioned, you want to wait 30 minutes after eating before you brush your teeth. So sometimes when I'm in a rush to go to school, I don't have time to wait 30 minutes after I ate breakfast. So that's why I also just do it right when I wake up. And then you also want to do it at night. So 30 minutes after you eat supper or right before you go to bed is great. And that's just because we eat so much throughout the day. So we want to make sure we're brushing twice a day. We also want to angle the toothbrush into our gums to clean all of our teeth. So in this picture here, you can see they're not holding the brush right straight to the tooth horizontally. They're a bit angled into the gums. And so if you're brushing the top of your mouth, you want to angle it a little bit into the gums too. We say around 45 degrees. And that's just because so much of our plaque is at the very base of our teeth. And so we want to make sure that we're trying to get as much as we can with our toothbrush, especially if we aren't able to floss. We need to do our best with our brushing. And then, like I had mentioned, that ClinPro toothpaste, the high fluoridated toothpaste, another one is Provident. That's another brand that's really good for a high fluoridated toothpaste. And you can get this over the counter at the pharmacy. If you go to Rexall or those type of things, that can help. And then also, if you're eating sugary foods, try to consume them with something like a dairy or a vegetable or anything that is going to kind of counteract that sugar or acidic environment. So if you drink lots of pop or any carbonated beverages like bubbly, then trying to drink water afterwards to neutralize that because that's really acidic. I also like to have bananas, but bananas have a lot of sugar in them. And so ways I counteract that is by eating it with cottage cheese, which is really good in protein as well. So that's great for our teeth. And also, like I had mentioned before, brushing your tongue. Don't forget to do that. That's really important. And you can just use your toothbrush for that. You don't need to buy anything special. Okay, and then patient management strategies. So this is kind of what I wanted to talk to everyone about when you go to the dental hygienist or the dentist and you feel a little bit uncomfortable. These are things that you can ask for or things you can think about that they may be able to give you to make it a bit more of a comfortable experience. So I know everyone here who does have Parkinson's, they probably take different medications and you know your body best. You know what works for you. So if you find taking your medication an hour before something is the most effective time, that's when I recommend trying to time it around your dental appointments. So I know it can be hard because some people can be a little bit more fidgety or move in the dental chair. And so trying to time your appointment around your medications when it works best is going to be really beneficial for you and hopefully make it a bit more comfortable. Appointments can be around 60 to 90 minutes. And often, if you let the clinic know beforehand, they may be able to make a time adjustment or try and get you in the morning if that's easier. Just really advocate for yourself because a lot of dental offices are accommodating, and I will give you one that's really good for patients with Parkinson's and other conditions. Patient positioning. So, if you're having a really hard time breathing or you feel like there's lots of things that are getting stuck in your throat at the dental clinic, they can always move your chair up. So the chairs are adjustable, so make sure if you're not comfortable, you let them know. There's also lots of blankets available oftentimes at clinics, or if you have a pillow that you want to bring in to put under your back or help with your posture, that can be totally something you can do. Or asking for a glass of water if you feel like your mouth is really dry. These type of things are something like the bare minimum that the dental clinic can do for you. So make sure you advocate for yourself. Another one is lots of clinics will have mouth props. And so these are bite blocks and they kind of put it on the one side of your mouth. And what this does is it allows you to rest your jaw, relax your muscles a bit because it keeps your mouth open. And so I've used this on lots of my patients if they have a hard time opening and closing their jaw, if it gets really tired. And so if this is something that you struggle with, they often have mouth props and you can ask for a bite block when you go to the dentist. Okay, and then this is that clinic that I was alluding to earlier. So it's called the Glenrose. And so I'm sure a lot of people have heard about the Glenrose. It is a big hospital, but it also does have a dental clinic in it. And so the Glenrose is located by Kingsway Mall in Edmonton. And the dental clinic there specializes in providing dental care to patients with medical conditions. The clinic is wheelchair accessible and it allows family members to come. So if you have someone that you like to bring to appointments, they are more than welcome to join, as well as it does have an overhead lift to get you in and out of the chair if that is something that you need. The dental clinic has a relationship with the University of Alberta Faculty of Medicine and Dentistry. And so students like myself are constantly working there. And there is also registered hygienists and dentists that oversee everything or may just do all of your care for you depending on the day that you go. So it is a very thorough place. I find these type of facilities because they specialize in treating dental patients with different conditions that they are a little bit more tedious and it's a very good experience overall. I talked to one of my instructors. She had both of her mom and dad go there and she oversaw the entire process and wouldn't recommend it enough. So I really recommend if you are looking for somewhere, this Glenrose is a great place. I tried to include some information, so I'll give everyone another minute here if they want to just write it down. So the phone number is 780-735-8810. And this is again located by Kingsway Mall in Edmonton. So they are accepting patients. I did talk to my instructor. And so I really encourage you to give them a call if you are looking for a place that is going to be a good experience for you. And this makes me so happy. I found this actually probably like an hour before this presentation. I was trying to find some pictures of the Glenrose to share with everybody. So this is what the operatories look like. And I just happened to stumble upon this post on Facebook. And so I'll just read it out loud for everyone. But this was a post from the Glenrose Hospital Foundation. So it says, Dick and his wife Bev, and that's in the bottom picture here, have been coming to the Glenrose Rehabilitation Hospital for the past 18 years, since Dick was initially diagnosed with Parkinson's disease. Over the years, Dick has participated in physiotherapy sessions and exercise classes specifically designed for Parkinson's patients. Not only was Dick received state-of-the-art rehabilitative care, but he and Bev also built a network of support including meeting other individuals and caregivers going through their own Parkinson's journey. As Dick's disease progressed, it became harder and harder for them to find quality dental care that could meet his special needs, including transferring him in and out of his wheelchair. Thanks to generous supporters from our donors, the Glenrose Foundation funded expansive renovations to the dental clinic 7 years ago. The clinic is uniquely capable of serving clients with complex medical needs and disabilities. It is outfitted with a MediLift, hydraulic wheelchair lift, stretcher accessibility, and an overhead lift for client assistance. So you can see that this is just a personal experience of someone coming to this dental clinic who had Parkinson's disease and they were able to really support them. So this Glenrose Place is a great, great option for you. Or if you know anyone with other medical conditions, encourage them to come here. It's really good. And I do believe that they do have a bit of a reduced rate on dental treatments. Another one is I encourage everyone to look into benefits. The Canadian Dental Care Plan is pretty new, but it is tailored to lower income families as well as seniors. And I really would encourage you to look into this plan. There is specific criteria that you have to fall into, but I know that a lot of seniors do fall into this. And so I would encourage you to just take a look or have a family member ask. And this could be something that really helps if there is a bit of a financial barrier in place. Okay, and so I think, yeah, we're at the 12:42, so this is perfect. So if anybody has questions, feel free to ask them.
So
Or if you
Brooklyn,
have them in the
there
chat.
are a
Yeah,
few questions in the chat.
great.
So I'll just kind of start at the top and we'll work our way through.
Okay.
Okay, so the first question, when I asked my dentist for fluoride varnish, he said I was to use a fluoride rinse every day.
Okay. And so a fluoride rinse is really good. So the reason that your dentist may have recommended a fluoride rinse and not just the varnish is because that varnish is something that they can only do every 3 months. That's like the shortest amount of time. So often they'll do it every 6 months too. And so the reason they're recommending that is because we want to constantly have daily fluoride. And so even though we have that on our toothpaste, we also want to have that in a mouth rinse if we do use mouth rinses. And so you can get OptiRinse. OptiRinse is a really good product, and that one does have that fluoride in it. So your dentist is completely right in that you can use a fluoride rinse. But also getting the fluoride varnish too is really good. You're not going to like have too much fluoride because you would get your fluoride varnish every 3 to 6 months, and then every day you're using your fluoridated toothpaste and your fluoride mouth rinse. I hope that that answers the question.
Okay. Someone's asked, Xylomelt tastes sweet. Is there a sugar substitute in the product? So is it, I'm wondering if they're asking because it is so sweet, does it have sugar in it?
Yeah, that's a good question. I could quickly, let me see. I'll see if I can find that.
And then while you're doing that, we
Yeah.
had someone share with us that one of their favorite tips that they heard from someone was when they were trying to find a way to hold their toothbrush, they were at the store and they bought a replacement bicycle handle and literally stuck their toothbrush in that. And then it was a
Oh,
bigger grip for them to hold on to. So rather than buying something to hold their
yes.
toothbrush, that's what they were
Yeah.
able to hold on to. So they just wanted to share that piece
Yeah,
of
that's great.
advice.
I appreciate whoever that was for sharing that because that is perfect.
The other question we had is you talked about the Glenrose, which is fantastic. Is there any place like that in other centers? Like, does Calgary have something similar or Red Deer?
Yeah, I could definitely ask around and try and look into that. And then maybe if you want to get these people's emails down, I can let them know and pass on any information that I get from that. Because I just don't know off the top of my head if they do have any in Calgary.
Okay, it looks
But
like
I can
Brandy
look into.
has done that. And she says that there's a general dentistry practice which offers specialized care for adults with special needs or medical concerns. And that's in Calgary at
Okay.
the Arthur J.E. Child Comprehensive Cancer Center. So that may be specifically for children, but it would be worth an inquiry.
Yeah, for sure. Just for the Xylomelt question, I
Yeah.
did look it up and it says that it's sugar free. So they
Sugar
may
free.
have it because there may be different flavors. So you could see if you could find maybe a different flavor and that might help with the sugar, but it is sugar free. So that's good.
Okay. Excellent. Are there any other questions that you can unmute yourself and ask the question if you'd like.
Hi, I'm Dina, Brooklyn. Do you
Hi.
know how, I think one of the things that sometimes can keep people from coming to a dentist, especially with Parkinson's, is they're not sure how familiar their dentist might be with
Yeah,
Parkinson's disease or the tremors or anxiety. Like there's all these, I mean, listen, those of us who don't have Parkinson's have anxiety about going to the dentist
yeah,
too. We love you,
for
but
sure.
you're not always, sometimes you're
Oh,
scared.
yes, I totally understand.
So do you have any tips or tricks or suggestions?
Yeah, so my tips and tricks would be you can always call beforehand. If you are a bit hesitant, you can always call beforehand and let the clinic know. And then that kind of reduces that barrier of feeling very anxious because then they have the idea they may be able to become a bit more prepared or give you information on if they are able to take you as a patient. As some clinics, as bad as it sounds, they will just get you to go elsewhere. And you can look at that as a barrier, but there is this Glenrose and there is other facilities that are more than willing to take you. So always calling beforehand to kind of see if that's an option. I know my grandpa, he still goes to Lacombe Dental in St. Albert, and he's been seeing that private practice throughout and has had great experiences. Also, just advocating for yourself. So if you feel like you need something, like I mentioned, the bite block, ask for it because we sometimes as care providers we don't really know. And I know that Parkinson's disease, it's constantly evolving and there is so much more research about it, which is great. And so that is kind of tying into what we're learning in dental programs as well. I can't speak for all dental programs, but I know U of A does a really great job at talking about this. And I have seen patients with Parkinson's at the K Edmonton Clinic here at U of A as well. And so I have had exposure, and we are constantly trying to incorporate that into our discussions and classes. And so I think it's slowly starting to become more aware, and more clinics are learning about it. But my best advice is just advocating for yourself. And if you feel like you need a fluoride varnish, ask for it, and then they can kind of explain that. I hope that kind of gives some clarity.
Yeah. And I guess I have a question. Can you brush your teeth too often?
Yeah, so this is funny because I'm gonna call my mom out on this one, but she used to brush her teeth like every time after she ate or if things were stuck in your teeth. And so I think it's really important if you are someone that snacks throughout the day, you don't want to be brushing all the time because then you're not waiting that 30 minutes. I think try and keep it to 2 to 3 times a day. If you feel like there is something stuck in your teeth, then try and floss. But if you can't floss, then you can brush. But yes, there is too much brushing your teeth. Like don't go past 2 to 3 times a day. Just because we want to allow our teeth to be in a remineralized state with that fluoride on our teeth. And we don't want to constantly be brushing that off, eating something, brushing it on. It's just like your mouth is never gonna be able to strengthen.
Is there any specialty kind of oral care for people with Parkinson's and dentures or anything that way?
I don't think there is. I know like there's denturists, but I not that I know of. I can look into that though.
Yeah, I
Yeah.
think sometimes, I mean, I've met clients who sometimes if the tremor's in the jaw, there's a little more movement going on in
Mhm.
there, potentially than normal. Listen, none of us know what we don't know, but these are
Yeah.
just some of the things I think we see from time to time. So I'm always just curious to learn more so we can help more people.
Yeah, I will definitely look into that. I'm gonna write that down. Because it's always nice to go to a clinic where like they know what to expect and they can kind of help manage that, like the Glenrose with hygiene and dentistry too. I totally get that. I also am going to go to the next slide here too. So it's just a thank you slide, a little motivational quote, and then this is my email. So if anyone has questions, you can email Charlene and she can forward them to me, or you can send them to my school email and I will completely answer them. So, but if we have any more questions right now too, feel free.
I will put one last call out there if anyone has any questions that they would like to ask Brooklyn. No, I don't think we have any more questions. So I again want to say thank you so much, Brooklyn, for sharing your expertise with us. We very much appreciate that. We also appreciate your enthusiasm for being part of the Parkinson community and wish you well and hope that you continue to be a part of the Parkinson community with us and stay connected. And this, as I said, this is being recorded. So for those that were unable to join us, they will potentially be able to view it, and then you may get more questions about oral care for people with Parkinson's, and potentially if we can't answer them at client services, then we may reach out to you for your
Oh, yeah.
expertise.
No worries at all. And thank you again for having me. I really appreciate it and am open to any feedback. So if anyone has anything afterwards, let me know. And I definitely will do it again in the future. So
Thank you so much. And for those of you that were viewing, thank you again for joining us. Stay tuned to the program calendar for other upcoming webinar Wednesdays that we have in our Ask the Expert series as well. So again, thank you so much. And we'll let everyone go. Enjoy the rest of the day.
perfect.
Thank you.
Yeah, you're welcome. There we go.
So there's a lot of thank yous in the chat to you for doing this.
Good, I'm glad.
If we do get any other correspondence or anything else, I definitely will pass it
Yep.
along to you.
Perfect. Thank you so much. I appreciate that.
All right. Well, thank you and good luck on Saturday. Keep us posted.
Thank
I'm
you.
sure we'll
Yes.
hear how things are going.
Sounds
All right.
good. Thank you.
Very good. Take good care.
Okay. Goodbye.
Okay. Bye-bye.